Hello, I am Dr. Meera Kondapaneni, and I am an Interventional Cardiologist and Director of the Cardiac Catheterization Lab at MetroHealth. My expertise includes treating coronary artery disease, which means blockages in the heart vessels, and aortic valve conditions, particularly the narrowing of the aortic valve called aortic stenosis. Today, I wanted to talk about aortic stenosis and the available treatment options. The aortic valve is a final exit door of the heart through which the blood flows to the rest of the body. The narrowing of this outlet, often due to buildup of calcium and scarring, makes it harder for the heart to pump blood out. Patients with this condition may notice trouble breathing, chest pain, feeling faint or lightheaded, particularly with exertion, swelling in the legs, and sometimes feeling too tired to perform their daily activities. The diagnosis of aortic stenosis is confirmed by echocardiography or an ultrasound of the heart. Once severe, aortic stenosis can be life-threatening. If left untreated, life expectancy can be as short as 2 years. If you or your loved one is diagnosed with aortic stenosis and it is not yet severe, you will need close follow-up with your cardiologist. If severe, you will be referred to our structural heart disease team that specializes in taking care of patients with this condition. We will perform additional testing to understand what treatment options are best for you. Surgical aortic valve replacement is performed by a heart surgeon and involves opening your chest by cutting through the breastbone and access the heart and replace the deceased aortic valve with a new valve under direct visualization. The alternative, TAVR or Transcatheter Aortic Valve Replacement, is a procedure that is done through a small incision made in the groin, and a new valve will be delivered to the heart through a small tube or a catheter. Both options are effective ways of treating aortic stenosis with some differences. Typically, an open heart surgery has a longer recovery with an average of 5 to 7 days in the hospital with a 6-week recovery period. Patients who receive TAVR, on the other hand, have a shorter recovery time and usually go home in 1 to 2 days. Most patients are up and walking in 4 to 6 hours after the procedure. The surgical approach requires general anesthesia, whereas TAVR can easily be done with conscious sedation or the so-called twilight sedation in most patients. A surgical method is preferred, especially in younger patients and in patients with coexisting heart conditions that require surgical intervention. Initially, TAVR was offered to only patients who are high or prohibitive risk for open heart surgery. Based on the ever-increasing experience with TAVR and the excellent and comparable outcomes now shown in multiple clinical trials for even low-risk patients, the guidelines now recommend that both options are safe and effective way of treating patients. You can now choose either surgical or the TAVR option with shared decision-making involving your cardiologist, a TAVR specialist, and a heart surgeon. Our structural heart disease team here with MetroHealth will provide you with all the support and resources you need to help make these decisions based on your and your loved one's individual preferences, values, and overall health condition. Our TAVR team includes a comprehensive group of interventional cardiologists, heart surgeons, anesthesiologists, heart imaging specialists, specialized nurses, and technicians. Our dedicated valve coordinators will help you navigate this process seamlessly. Our team is here to mend your heart and get you back to doing the things you want to do. To schedule an appointment with one of our cardiologists, please call 216-778-2328 or visit us at metrohealth.org/TAVR. Thank you.